We've got friends from all over the state chiming in. We're so excited. All right. We will let everyone trickle in as they come, but I'm going to go ahead and get us started. We'll do a few introductions, and then we're going to hear from our wonderful, amazing experts, Dr. Sara Carpenter and Mr. Ryan Call from EcoCycle. But first, I just wanted to give a little introduction. My name is Lex. I am the Public Education and Outreach Manager at EcoCycle. I oversee the Eco Leaders Volunteer Network and do lots of our outreach. So you've probably seen my face around. Today, we're talking about plastic pollution and human health. Before we get into that, I do want, let's see if I can advance my slide. We're just going to go over a little bit about EcoCycle as an organization. So we are a mission-based nonprofit, a mission-based recycler, which means that we focus on getting those materials into the right streams and really recycling them and keeping natural resources in the ground. The whole point of our of recycling is to limit our extraction of natural resources, right? And so that is our main mission, kind of switching into a more circular economy rather than linear make, take, and waste. EcoCycle started in 1976. We just celebrated 50 years this year, woohoo! Which makes us one of the oldest and largest nonprofit recyclers in the country. We're really proud of that. We really do. We're really guided by our values of protecting those natural resources. We operate the Boulder County Recycling Center, opened in 2001, and we also operate the Center for Hard to Recycle Materials, the CHARM. Both of those are on Recycle Row in Boulder, just off of Arapahoe. And we've been operating both of those facilities for 25 years, and we're having so much fun doing it. We have an award-winning environmental education program. We're in K through 12 classrooms across Boulder Valley School District, St. Vrain Valley School District, one school in Jefferson County, and some in Adams 12 5-star. And so we are in those classrooms educating from just a little 5-year-olds all the way up to 12th grade on environmental education and zero waste topics, as well as composting their organic materials in a lot of those cafeterias in the schools. We have amazing community compost programs, including the Farmers First program, where we're taking that organic scrap from our local schools and bringing them to local farms where they're being composted and returned back into regenerative soil. And we also sell microbrew tea, which is our extract of compost that we create using local scraps as kind of like a natural fertilizer for your plants. We also have commercial hauling services. We haul recyclable and compostable materials from commercial sectors in Boulder County, where they come to our CHARM and get filtered in through our recycling system. And then we have a really awesome policy team, which Ryan is part of. And we are passing some really amazing state and local policies. We are at the legislature and really, with the help of our eco leaders and our community voice, making a lot of big changes in Colorado. You're going to hear a little bit more about our policy work, so I won't dive in too deep on that, but we're very proud of what our team has been able to do. We focus on all things zero waste. So we are a recycling operator, but we do love to reduce and reuse and refill. And so you're going to hear a lot of zero waste topics and a lot of different zero waste kind of techniques in this presentation. Like I said, if you have any questions, please feel free to put them in the chat. We would love for this to be an interactive presentation, but we also have a Q&A session at the end planned after we hear from both of our experts. So your questions will be answered. Here's just a little visual of all of the different things EcoCycle does. You can see our hard to recycle materials collections. You can see our haulers over here and all of these cute kids recycling their materials in their classrooms. And it feels really good to see the community come together around zero waste. Our mission is to innovate, implement, and advocate for local and global zero waste solutions to foster a more regenerative, equitable, and climate resilient future. Like I mentioned, we're taking that make, take, waste approach, that linear economy, to a more circular economy where we don't necessarily create waste, we create a resource to be turned into something else. Okay, that's a little bit about EcoCycle. Of course, there's so much more to learn. Please check out ecocycle.org if you're interested. But I'm so excited to introduce our two experts today. With us, we have Dr. Sara Carpenter. She's the Executive Director of Healthy Air and Water Colorado, a nonprofit that works to elevate the voices of health professionals to keep public health at the center of policy and energy decisions. She's also a retired pediatrician and public health advocate. She did her medical school at the University of California, San Francisco, her residency at Children's Hospital, and a master's in public health at the University of Colorado. She is committed to the work of solving climate change and the plastic crisis and creating a healthier world for future generations. We're so excited to have her with us today. And then we also, after Dr. Carpenter presents, we'll have Ryan Call from EcoCycle present as well. He is our policy and campaign specialist. He earned a master's in environmental policy and management for the University of Denver, where he focused on sustainable waste management and circular economy policies. Ryan has been with EcoCycle for over 5 years and has led and collaborated on numerous successful zero waste projects around Colorado, which we're going to hear a little bit about, including legislation, consulting, local policy, rulemakings, and educational programs. Thank you both so much for being here. We're so excited for this discussion. I am going to hand over my sharing to Dr. Carpenter, and we will get started with plastic pollution and human health.
Thank you very much, Lex. I'm so happy to be here. Let me share my screen and we will see how we do this. Hopefully, does that work? Does that look good? Okay, terrific. If you can't hear me or whatever, let me know. Well, thank you all for including me in this important conversation and for everybody who's joined us tonight. I appreciate it. I am trying to find my arrow. There we go. I just wanted to give you a little bit about my why. I actually grew up in New York, close to New York City, and might not be expected to be much of an outdoorsy person. Actually wasn't as a child. Didn't have much opportunity, but Jane Goodall was always my hero. And I had the great fortune during my training to spend time in both Rwanda for 6 months, almost 6 months, and in Nepal, and to just really be out and experiencing the incredible globe, the incredible earth we live on, and the incredible communities that inhabit it. And I really believe deeply that in this quote from Jane Goodall, that you cannot get through a single day without having an impact on the world around you. What you do makes a difference, and it's really up to us to decide what kind of difference we want to make. That's why I'm here today, because I think plastics is a big issue we need to be addressing. So the paradox of plastics is that they have absolutely revolutionized the way we live. But as they've done that, they have polluted the planet and become a threat to our well-being. Nearly 10 billion tons of plastic has been produced since 1950. And global plastic production is expected to increase at a rate that will nearly triple by 2060. If we do not address this, so we are at this about inflection point here, we've more than doubled what was produced almost since 1950, and this is an untenable rate of growth. The lifespan of the average piece of plastic varies by its use. Many plastics, such as in the building industry or in transportation, last over a decade, sometimes multiple decades. Textiles are about 5 years. That's, I think, probably decreased since 2017 with the advent of fast fashion. But if you look at packaging, it's about half a year. And the problem with that is that the vast majority of plastics are single-use plastics, almost 35 to 40%. So the vast majority of the plastics we're producing are only lasting less than half a year. So where does it go? Worldwide, about 10%, 9% to 10% are recycled. But in the United States, upwards of 73%, according to our World in Data of 2019, went into a landfill. So we are making this stuff, using it for a brief period of time, and then in the United States anyway, generally burning it or putting it in a landfill. And that poses a problem for us for many reasons, the first of which is climate change. So it's a chart of emissions associated with plastic production. And under our current business as usual plan, um, by 2050, upwards of almost 30% of the global carbon budget will be devoted to plastics production. And at that rate, we will not be able to keep temperature rise below 1.5 degrees Celsius, which is really not actually at anymore. Um, I think we often don't think of plastics as a major contributor to climate change, but if plastics were a country, as of 2019, it would be the fifth largest emitter of greenhouse gases just before Brazil. So it's a significant contributor to climate change. It's also a significant contributor to environmental issues. Upwards of 1/3 ends up as litter in the environment, and the open incineration of plastics releases dioxins and other toxic chemicals, leaving a toxic slag behind, often in environments that are disproportionately impacted communities, the global south. Our trash ends up in other people's backyards, being burned and causing harm. So it's an equity issue as well. With respect to human health, we are seeing microplastics as an emerging and pervasive threat, readily leaching chemicals into our environment. There is emerging widespread evidence of plastics in our bodies and links to reproductive, respiratory, cardiovascular, and neurologic conditions. So we're going to talk about that. But before we do, I think it's worth taking a step back and actually looking at what plastics are. At its core, a piece of plastic is a product of fossil fuel. We think of fossil fuels as coal or natural gas or oil. Most plastics come from ethane, which is a byproduct of fracking. We mix the carbon material with chemicals, and out the bottom comes some sort of plastic. It starts with a carbon polymer backbone. The black dots here are carbon. The red is oxygen, and the white is hydrogen. And these form, you can think of it as a sort of skeleton providing structure and strength to the actual piece of plastic. And then chemicals are added to achieve whatever the desired property is of the plastic. So we'll add phthalates or bisphenols. Phthalates make things kind of softer and pliable, so good for kids' toys, for instance. Not great for the kids, but good for the toys. Bisphenols, which have had a lot of press. PFASs are brominated flame retardants. And these end up kind of popping in wherever they land in the middle of the structure, but they're not actually attached to the backbone of the plastic, which becomes a problem as the plastic breaks down or as it enters, as it's heated or has an acidic or fatty environment. The chemicals then can leach away from the plastic backbone because they aren't actually physically attached. And as we look at plastics, we can think of almost up to 50%, depending on the plastic by weight, can be made up of these chemicals. So then we look at the chemicals that are associated with plastics, and PlastChem is an organization that published this report in 2024 that identified over 16,000 different chemicals in plastics, of which 26% were identified as actually being hazardous to human health, and 66% were identified as actually having no data associated with them. So not studied, unclear, unknown, but being actively used and potentially leaching into our environment. Of the 16,000 plus chemicals that were identified, fewer than 1%, 161, were actually identified as not hazardous. And these plastics are added for a variety of reasons, as I said, to kind of give you whatever component of the property of the final product, but the flame retardants obviously reduce flammability. The phthalates tend to soften. The bisphenols are hardened, so those are in the polycarbonate reusable water bottles or in a variety of other harder plastic that we use often for food. And then the PFAS is used in addition to being like Teflon in a pan. It's used for grease resistance and for lubrication. So I'm not going to go into recycling because I think Ryan's going to spend a bunch of time on that. But this is just a chart familiar to most of you, I assume, about the numbers around what can be recycled. Many of these actually don't get recycled the way we think they do. And many of them, for instance, the bread bags, the yogurt cups, the straws end up being single-use plastics. So contributing to that significant, the water bottles, shampoo bottles, those kinds of things. So now when we think about plastics and human health, there's really two different components of the plastics that cause problems for us. And the first is the chemicals. We've talked about how they can leach out of the plastics and make their way into the environment and ultimately into our bodies. And the second is the actual particles of plastics themselves as they break down. So we're first going to talk about the chemicals themselves. And tonight we're going to talk about endocrine disrupting chemicals. There are chemicals that are, as I said, toxicants. There are carcinogens. There's lots of different types of harm that can be caused from the chemicals. Endocrine disrupting chemicals disrupt the endocrine system. This is a graphic of all of the endocrine glands in our bodies, and many people may or may not know about these. The common ones that we think about are thyroids. People don't often think about their bones as being a source of endocrine function. Our adrenal glands, the pancreas. Pancreas produces the cells, has the cells that produce insulin for us. All of these can be impacted by different endocrine disrupting chemicals. The network that is so the hormones that are associated with all of these and the endocrine system regulates all of the biological processes in our bodies from conception all the way through adulthood. This includes the development of our brain, the nervous system, our reproductive system, our metabolism, how fast we process food, how well we regulate glucose, our moods, our blood sugar levels, and our immune system. Normal functioning of our endocrine system is critical for our health and well-being. And we know that endocrine disrupting chemicals can impact all of these. This is a list of some of the more common endocrine disrupting chemicals. There are a couple of things that are really important to realize about EDCs. One of the first is that there isn't really a clear, safe dose. So for instance, when a level is set by the federal government around PFAS in waters, that's a hope that that level will below that, at or below that level will cause minimum harm. But there are plenty of studies that suggest that even very, very low levels at a critical window of time can cause significant disruption to the endocrine system. Exposures that occur over long periods of time are not necessarily reflected in spot testing. So going out to your local lab and getting a test today can tell you what's happening in your body today, but it doesn't necessarily tell you the impact that the long-term exposure that we have day after day after day is going to have on our health. Effects can be different based on periods of vulnerability, and we'll talk about this a little bit later, but age or other diseases that you may have, other health-related problems can make you more or less vulnerable to the impact of these chemicals. And then there can be a long delay between the time that you're exposed and the actual onset of whatever problem it's going to cause. So I want to take a minute before we launch into some of the health issues to touch base about bisphenols, because I think this, many of you probably know about BPA. That was in the news a great deal many years ago between the 2000 and 2010s, because it was one of the first identified and publicly in the public as an endocrine disruptor. And it was in our water bottles that we were using to decrease single-use plastics, and our baby bottles, and in our plastics that from our yogurt and everything else. So the news cycle picked it up, and the news cycle identified it as a problem. And so the companies that were using bisphenol A said, oh, shoot, we got to change this. Otherwise, people won't buy our products. And so they substituted bisphenol A with bisphenol S and bisphenol F. And I have the organic structure of these molecules here, not to give you a lesson in organic chemistry, but to show you that these actually are, you could call them sisters of each other, and they're really very close in structure. So this is what's called a regrettable substitution, where the bisphenol A, BPA, is taken out, and products can then be labeled as BPA free, the consumer thinks that that makes it safe. And in reality, if it has BPS or BPF, there is the risk that the issues caused by the BPA will now just be caused by the BPS or the BPF. Now, we don't know that for certainty. Sometimes substitutions can be better or healthier, but many times they can actually be the same or worse. And they're not tested. So a regrettable substitution is when something's put in place to replace the one that's identified as bad, but isn't necessarily better. And we know that BPA is still people, 93% of people still test positive for BPA because it hasn't actually been removed from all. It's still in cans of soup or in linings of food and drink containers or in medical devices, dental implant or dental coverings and in receipts, thermal receipts you get from the grocery store. These chemicals bind to estrogen, or testosterone, or the thyroid or glucocorticoid or the glucose receptors, and then cause changes in functioning of those. So I just wanted to make that point that so you're aware of what a regrettable substitution is. So another big part of what these chemicals, why these chemicals are so problematic, is that they impact us at different periods of time, and fetal development and pediatrics, children, babies, and young adults are among the most vulnerable population because they are still growing, and the timing of the exposure can make the chemical much worse than it might be in a different time of life. So this is sort of a list, clusters, a picture of just all of the different clusters of disease that have been identified by endocrine disrupting chemicals. We're going to focus today on just cardiovascular, respiratory, and brain disorders, but there are a wide gamut of impacts that these can have. So in women, the endocrine disrupting chemicals can impact because they are estrogen-like. They often bind or mimic estrogen. They can disrupt many reproductive processes in women, and in potentially if a female fetus is exposed, can interrupt the development lifelong because of that exposure. But we see in women with high levels of endocrine disrupting chemicals that they can develop polycystic ovary syndrome, which then can lead to metabolic syndrome and can lead to fertility issues. Endometriosis, which can also lead to fertility issues. They do increase the risk of hormone-sensitive cancers. So in women, breast cancer; in men, that could be prostate or testicular cancer. And we also can see early menopause. We do know that in the Western world, the average age for a girl gets her first period has been declining a month or two every decade since the 1970s. And that may not seem like a huge amount, but over time, girls are getting their periods a year to 2 years earlier than they did 50, 60, 70 years ago. And with that is an increased risk in developing obesity, developing breast cancer, and type 2 diabetes. So these have significant impacts. In men, we see similar impacts in the form of sperm counts declining over time. And this is a really interesting study that was done by a researcher named Shauna Swan, who's in New York at Mount Sinai. And she started this study published it in 2017, but looking at 1972 to about 2010 and looking at sperm counts across the globe. And in that first paper, they didn't really look too much at the global south. And they found that sperm counts over time were decreasing at a rate of about 1.16% per year. So a pretty significant decrease over time. But then they came back again and added an extra 7 years of time and then added the global south. So they increased the number of people they were looking at, and they found that comparatively from 1973 to 2018, there was a 50% drop in the sperm counts across the globe. And then when they plotted this out, they actually determined the slope of these two lines. This is from their original paper, and this is from the second paper. And when they added in the data from the second paper, it became clear that not only were the sperm counts continuing to drop, but they were dropping at a greater rate than they were previously. So significant concerns there globally about fertility, but also because much like in women who've had their endocrine system disrupted and everything that's estrogen related disrupted, men who've had this is largely testosterone based, are at a greater risk of other kinds of disorders, including testicular cancer, uh, and decreased lifespan and chronic disease. So very significant issues all associated with these endocrine disrupting chemicals. So Dr. Swan took this a step further, and I was going to do a little video of this, but I'm not have time. So she's done an enormous amount of research over decades on infertility. And after this last study that I showed you, she decided to do a bit of an experiment, which she describes in a documentary called The Plastic Detox, in which she took a set of six couples who were struggling with infertility, and she led them through a plastic detox and follows them over a period of time to see if taking the plastics out of their lives improves their fertility. And I won't give it away. I would encourage everybody to go and listen to it, although I am definitely not repping Netflix. It is a very thought-provoking documentary, and it led her to decide that it was not a scientific research study in the context that the numbers were not big enough and the degree of data collection was not significant enough that they could publish this and say, we know with certain it causes this or not. But it did give her enough information to make her want to do that scientific study. And so she is embarking on putting that together. And hopefully in the next couple of years, we'll have some more information about whether or not doing the plastic detox might increase our fertility. So then thinking about pregnancies, we do know that endocrine disrupting chemicals also can go from the mother through the placenta to the baby. And studies have started to look at what actually happens to the placenta itself when women are exposed to endocrine disrupting chemicals. In this study, they determined that the endocrine disrupting chemicals actually, these are in here this is the mother side. A placenta actually has two distinct sides, the mother's side and the fetus's side. And in the middle are these little villi, and the vasculature, the villi kind of stick in here, and it's really an important this part of the placenta is a really important part of for transfer of nutrition and removal of toxins. So the baby can't get rid of all the toxins itself. It goes into the mother, and the nutrition from the mother comes here. But also critical to the health of the placenta is that the placenta implant onto the wall of the uterus in a way that allows it to develop all of the structure, the microvascular structure that it needs. And the study determined that endocrine disrupting chemicals actually disrupts that process through which the placenta implants. When that impacts the blood supply to the baby, it causes a couple of things. It causes the baby to not thrive, but it also can link to a problem called preeclampsia. And that is one form of hypertension that can develop in women during pregnancy or right after pregnancy, right after delivery. It can be associated with low platelets or kidney disease, and it can be life-threatening to the mother. And interestingly, over the last couple of decades, the rates of preeclampsia have nearly doubled. So a concerning problem to figure out that actually the damage caused to a placenta could lead to maternal and fetal impacts. So a review of the pediatric impacts that have been shown. A lot of this work has been very specific to phthalates and to some of the bisphenols. See poor growth in utero, so low birth weight when babies are born, and prematurity, so being born too early. There is some suggestion that even ADHD traits or autism-like behaviors may be associated with these chemicals. And potentially asthma, wheezing, and eczema, so allergic disorders. We definitely know that endocrine disrupting chemicals can increase obesity, triglycerides, and glucose regulation can be disordered. And then there's a whole nother type of problem that evolved that has been studied and is well documented now, that's called the phthalate syndrome. And this is in male fetuses who are exposed to phthalates in particular. that seem to have an anti-androgenic effect. So the androgenic effect is what masculinizes the fetus. And during the important window in which this happens, the phthalates disrupt it. And so a very specific set of symptoms that are here, and I won't go into these in great detail, but what ultimately this leads to is abnormal growth of the male genitalia and low sperm count. We also know that preterm birth occurs by virtue of these exposures to endocrine disrupting chemicals. And Leo Tresand is a researcher at NYU who has done an enormous amount of research on plastics. And he took a very interesting take on this. He tried to attribute how many preterm births in the United States were caused by phthalates. And in 2018, he published this in The Lancet, estimating that almost 60,000, excuse me, preterm births could be attributed to phthalate exposure. And then he took it another step and he tried to estimate the social and healthcare costs of those, for which he came up with the estimation of $3.8 billion just from the phthalate exposure alone. And then lastly, we'll look at chemical. This is a correlation, so I want to be clear about that. This is not to demonstrate causation, but this is a graph of chemical production over time, diabetes and obesity. And we know that both type 1 diabetes and especially type 2 diabetes is increasing in frequency, as is obesity. And this just shows the correlation between the increase in chemical production across the globe and the increase in these two. We do know from animal models that there's a great deal of research in animal models demonstrating that these endocrine disrupting chemicals are obesogenic. That means that make the animal more likely to develop obesity. And in some studies have shown that when a female who is pregnant is exposed to these, that it can actually, that obesogenic effect can carry over to the offspring. So now we're going to pivot and talk a little bit about microplastics. And I just want to, as we shift gears, sort of put into context that we researchers have been studying phthalates, endocrine disrupting chemicals, other toxicants, pesticides for decades. Microplastics is a field of study that is very young. Every year, the number of published papers looking at microplastics in peer-reviewed journals is exponentially increased. But the field is still young, and the body of evidence is still evolving. So microplastics can come from two different places. You can have nurdles, which many of you may have even gone on nurdle hunts. These are the precursors of larger plastics. So they're the feedstock when a company is going to make a plastic product. They may purchase a nurdle from someplace and ultimately take it into a factory and produce something from it. So nurdles can be an introduction of microplastics into the environment at any part of their life cycle, from the production plant where the cracker plant makes them, to the transit. They're tiny, the size of a lentil. So they get loaded onto trucks or onto trains, and if not carefully contained, the wind can blow them, they can leach into the soil, the air, and to waterways. Spills in transit or factory spills, and then in the actual production of the final product, the nurdles can leach microplastics into the environment. But the vast majority of microplastics actually come from the breakdown of the enormous amount of plastics that have been already produced. We have to remember that plastic isn't biodegradable. It just breaks down into smaller and smaller pieces. And to give you a sense of how small, microplastics are defined as anything that ranges from 1 micron or micrometer to 5,000 micrometers or 5 millimeters. So on the far left of this scale is a piece of nanoplastic, which is actually smaller than a virus. And then you see the smallest version of the microplastic, which is actually smaller than an E. coli bacteria. And so you can see on the scale, we're talking about really pretty small things. A larger piece of microplastic, like 5 millimeters, obviously you would be able to see. Oh, I lost my, here we go. I'm trying to get my Let me see if I can. Sorry, there we go. So why should we care about microplastics? Well, virtually every organ in the human body, mine and yours included, have microplastics in them, including the reproductive tracts of men and women. It's been found in uterus, ovary, semen, reproductive hormones, during pregnancy and after pregnancy, in the placenta, the amniotic fluid, in breast milk, and in infant feces, and in every other organ that's demonstrated here, from our hearts to our livers to our stomachs and our brains. How do we get it into our bodies? Well, it comes through either dermal contact, so our clothing, synthetic clothing that's made from polyester is a form of plastics. And so as that breaks down, those microfibers can break down and further cause dermal exposure. We can inhale them. So small enough particles that are airborne can come into our lungs. And if they're small enough, make their way into our bodies. And then the vast majority of it is ingested. And if you look, the food supply, we know a lot of people have heard that the oceans and our fish are often contaminated with microplastics. That holds true actually of land mammals as well. And there have been studies that have looked at plants and actually demonstrated small pieces of microplastics that have been taken up into a plant structure by the soil and water that it has grown in. So how do microplastics hurt us? Well, nanoplastics, the tiny, tiny, tiny ones that were even smaller than a virus, are small enough to actually get into our cells. And in the cells, then the chemicals, the endocrine disrupting chemicals or something else that's attached to it can from there have access to disrupt our hormones. Or they can cause stress by causing inflammation, damage to the DNA. There's even a question of whether or not, if they're sharp enough on the edges and the shards, could cause physical damage to the cell. So as I said, this is a new, relatively new field of study, and new technology is constantly evolving to help us figure out how to study this. There have been, and I won't go into all of the vastly different types of analysis that have been done. But the most important the most important things that we need to remember about them as we look at the microplastics data is that the research is still evolving. And so it is not as there's more evidence with respect to the chemicals to actually say we think this is causing something as opposed to being correlated with it. Different techniques are constantly being invented or verified to work in the field of microplastics, and then being used to corroborate evidence that was determined from a different type of analysis, with the end goal of creating what in science is sort of the gold standard, which is reproducibility. So if I find a finding of a study in one paper that was published, can somebody else replicate that in a different lab, in a different setting, maybe even using a different technique? But the more we look, the more we find. So this is a couple of pictures of just what microplastics look like when you look at them under an electron microscope. They can be very sharp. They can be sort of little blobs. But the more we look, the more we find. How they get into our bodies, this is an image of a small area of a gastrointestinal tract, and they are able to get into the middle of that and then leach through the system. Through our respiratory tracts, they can come in, we can breathe them in, they can go through our larger parts of our respiratory tract down into the very small tubules that then connect with blood vessels, and they can get from the alveoli, which are the little small air sacs, into the blood vessels, or they can go through our blood vessels themselves because they're smaller than the red blood cell. So looking at plastics in the placenta, this study was actually a review of multiple different studies for plastics in the placenta. And I put it here because it gets to our question of reliability and reproducibility. So I won't go into the methods, but these different studies used a variety of different types of methods to identify how much microplastics was in the placenta. And if we look at the frequency of it, consistently, sometimes in all of the placentas, they were finding pieces of microplastics, sometimes not all of them, but consistently finding microplastics, which tells us that it is probably, we can feel probably pretty certain that microplastics do exist in placentas. So this is one example of harm from that. The placentas in this study, the placentas from 43 women were looked at to be examined from microplastics, and the women were followed. The placentas were looked at after they delivered. 13 pregnancies had been complicated by fetal growth restriction, and microplastics were found in all of them. Microplastics were also associated with lower newborn assessment scores. So a newborn is born, and then their health is assessed, and there's a series of tests that are done to determine how well the baby is doing. And they had lower scores. But in the 30 pregnancies that were normal, microplastics were only found in 3. So again, this is an association. We cannot say with certainty that the microplastics were what caused all of these issues in the abnormal pregnancies, but it's certainly a concerning pattern. So then if we shift and look at heart attacks or in the cardiovascular system, this was a study that many of you may have seen, looking at, this was in the New England Journal of Medicine, and it looked at 257 patients who came in, probably they were not ill, and they had determined through some sort of study that they needed to have plaque removed from their carotid arteries before it caused a problem. And of those, 58%, 58.4% had a detectable amount of microplastics in that plaque that was removed when their procedures were done. Looking at what happened over time, these patients were followed for almost 3 years, 34 months. And then the researchers went back and compared those who had an additional heart attack or a stroke in the 34-month period that they were followed, and compared those who had with those who hadn't, around how many had microplastics. And they found that the folks who'd had microplastics determined in the plaque that was removed from their arteries had a 4.5 times greater risk of having a heart attack, stroke, or death in the 34 months following their initial procedure. Now, these people, the subsequent comments about this study criticized the authors for not having blanks, which means having a kind of a control, piece of something that was in the lab or in the OR and used the same exact pipette or the same tube that had the plaque put into it, just to make sure that all of this microplastics wasn't introduced in the actual process of doing the analysis. But they did not, 40% of people did not have any microplastics, and the authors have pushed back on that subsequently. And there is additional work being done, a lot more work being done to look at cardiovascular risk. So again, we cannot say causation, but the correlation here is clearly concerning. And then lastly, we're going to talk a little bit about microplastics in our brains. And I want to tell you a little bit about a woman named Eve Rowland who has done some interesting work on kangaroo rats in New Mexico. So there's a natural history museum in New Mexico that had a bunch of kangaroo rats stored from the 1960s. And then another set that was, I think, from the 1980s or 90s, and were stored in jars and had just been kept for posterity. And for future study. And so Eve Rowland took these animals and looked at their brains and looked for microplastics in their brains. And then she took a sample of current kangaroo rats that were live and looked at the amount of microplastics in their brains. And this is not published data, so I don't have graphs to show you. But over time, what was determined is that the samples that came from current times, not 2026, but I think it was about 2024. And the samples that came from around 1995 to 2005 had increasing amounts of microplastics in them. So the most microplastics were in the most recent samples. And then there was a moderate amount of microplastics found from the samples from the turn of the century, around 1995 to 2000. And the microplastics were basically undetected in the samples from 1966. So a really concerning but pattern that suggests that goes along with what we believe, which is that as plastic production has increased and as our environment has become increasingly polluted with microplastics, we are having a greater load of them in our bodies. So then this was a study that looked actually at human brains after people had died. They were able to receive the brains from, they worked with a coroner and I believe had permission from families. But they looked at people who had died and looked at their brains, their livers, and their kidneys. And they looked at the amount of microplastics. And they did this in 2016 and in 2024. And looking at the samples, they were able to determine that between 2016 and 2024, there was a statistically significant increase in the amount of microplastics in the livers and in the brains. And notably, the brain tissue seemed to have an affinity for the plastics, so that there were far more microplastics in the brains than in either of the other organs. But this pattern held true and was sort of bore out what Eve Roland found in the kangaroo rats. An interesting corollary. Then the study went a little step further and looked at dementia cases. So they looked at people who not only had died, but had died with a diagnosis of dementia. And they found that those people, the brains of those individuals had a significant amount more. So this is, so you can see this is 0 and this is 10,000, and then it goes up from there in terms of the micrograms per gram of brain. So micrograms of microplastic per gram of brain. So a considerable amount more of the microplastics in the brains of people with dementia. So what does that tell us? It doesn't tell us very much. It's an interesting association. We cannot assign causation to that. We can't say that the microplastics cause the dementia. We do know that people who the brains of people, patients with dementia, are not normal and may have leakier blood vessels, may be more predisposed to accumulate the plastics. But it was a very interesting study that showed this correlation between the plastics and dementia, and certainly that the brain seems to have an affinity for collecting the plastics. So then a researcher in Rhode Island actually did a prospective study looking at the effects of microplastics on mice. And she asked the question, can you affect cognitive functioning in a mouse if you give it microplastics? And she took 2 sets of mice, one set that had genetically been altered to carry the gene that makes them more likely to have Alzheimer's. That's called the ApoE4 gene. And you might have heard about that because Chris Hemsworth, who plays Thor in the Avengers, if you like the Avengers, has been very public because his father has early onset Alzheimer's. And so Chris Hemsworth tested himself and actually carries the gene for this. So he's been out doing a lot of public education around early onset Alzheimer's. So she had a set of mice that had that gene and a set of mice that didn't have the gene. And then she gave both of those mice regular water and water that was laced with microplastics for 3 weeks. And she found that in the group of mice that had the genetic predisposition to Alzheimer's, so they had the abnormal gene, the mice that got the water that was laced with microplastics, actually it was polystyrene in particular, were more likely to develop abnormal behavior. The male mice actually developed something they called apathy, which was basically they put them in a box, they put them through a series of tests, put them in a box, and the mouse, instead of running around the edges of the box, which is where they should be, they're programmed not to be out in the middle of the room because that's where the predators can find them. These mice that were exposed sort of wandered around the box and didn't seem to care whether they were along the edge or in the middle where they would have been at risk. And the female mice, in studies in experiments where they would put them in mazes or in places with with objects, that maybe they had food or maybe there was a reason they would go to that object, they would take these treated mice and put them in, and the females seemed not to remember that they had seen that object before and it had food, compared to the other mice that had not been exposed or that didn't have the gene. So it was an interesting study that demonstrated that, in fact, perhaps the microplastics were doing something in those animals that were predisposed because of the genetic abnormality. So I'll stop there with the health risks. That's a lot of information. Uh, and sort of we ask, what do we do? So I'm a fan of Calvin and Hobbes, and this is a little graphic. I'll let you look at it yourselves. But basically, Calvin decides he's going to make his own path. He says change is invigorating, and if you don't accept new challenges, you become complacent and lazy, and your life atrophies. And then he takes them off a cliff. So I'm not suggesting we go off a cliff, but I am suggesting that the answer to our problem is to reduce production. And part of that is because we really just cannot recycle our way out of this problem. Uh, excuse me, we have to slow down. As you saw, all of the plastic that's been produced on the planet that hasn't been burned is still with us. So the only way to stop the pollution is to stop the production. And how do we do that? Well, we do it by government action. That feels maybe hard right now. We do it by swaying public opinion, and we do it through individual action. Government action actually is happening, and I know it can feel like it's not, but many states, excuse me, are actually working on addressing this problem. At least 33 states in 2026 were considering policies addressing toxic chemicals. And if you are interested in this, I highly recommend Safer States. Their website is here. They are a great organization, and they have amassed this policy document that outlines this. The Global Plastics Treaty is another multinational government, or trying to be a government action, that was actually through the United Nations Environmental Assembly in 2022. 185 countries were involved. They met 6 times, most recently in August of 2025 before the UN Assembly in New York in 25, with the hope of passing a global plastics treaty. They were unsuccessful, but there were many countries that redoubled their efforts to reduce plastic pollution and to continue this fight. And to continue it despite what the larger countries like the United States and Russia decide to do. This also makes individual action even more important, not just to decrease our own plastic exposure, but to try to influence around the globe what our governments are doing. So what can you do at an individual level? You can be an educated consumer. We appreciate you joining us tonight. You can read labels. You can read resources, and I'll give you some resources at the end of this. Reduce your use of single-use plastics. And I think sometimes we forget how many of those we use, but our yogurt containers, our hummus containers, our juice containers, all of those are single-use plastics. So the more we can decrease those, the better off we are. Not microwaving food in plastics is really important, but also trying to avoid fatty foods whenever possible that are wrapped in plastic, because of the fat does tend to increase the risk of the transfer of chemicals. Over time, make changes to your lifestyle, reducing plastic bottles, transferring to more reusable, either glass or stainless steel, cooking, making sure your cookware it does not have PFAS in it, using wood cutting boards or using metal and ceramic. This is all expensive to do. As you retire a Tupperware, replace it with glass. Avoiding synthetic fabrics, again, over time. The synthetic fabrics, when you put them in the wash, send thousands of microplastics into our waterways. So the more that we can transfer to more organic, natural fibers as opposed to synthetic fibers, the better. And then think about joining or donating to organizations. But you also have a voice, and I would encourage you to vote with your wallet, picking products that are more sustainable and aren't going to harm the environment. Voting with your ballot for either policies, regulations, ballot initiatives, or elected officials who are committed to working on this problem. Express your opinion, make it known to your elected officials or to your community through letters to the editor. Take it to your workplace. Change what's in your break room or start conversations there. Educate your family and friends, and support where possible the many organizations that are doing this. These are a whole lot of resources. I think you'll get the slides at the end of this, but I would highlight Healthy Air and Water Colorado, our organization. PSNAP is another organization that is the Physician and Scientist Network addressing the health harms of plastics. I'm part of that organization as well. And they are doing great work to lift up, again, scientists' voices and drive change. The Plastic Pollution Coalition.org is a fabulous resource for how to get plastics out of your life, as is many of these others. And then apps. Clera is an app that helps you understand what's in personal care products in particular. Made Safe and EWG Verified, sorry, I left the D off that, can also be very useful for finding products that are healthier. And then I just want to leave you with a couple of reasons for hope. Plastic-free babies. And Rethinking Materials are both organizations from that Sean Sutherland, I think is how you pronounce it, started. And she is an incredible force of nature. She's in the UK and she has taken on the plastic crisis herself, and she's created entire organizations to focus on it. So Plastic Free Babies is a new program she's rolling out in the UK. She has been working with advertising agencies, TV stations, legislators, hospitals, to try to create a movement for babies to have the first 1,000 days plastic free, the first 1,000 days of their life from conception to about age 2, a little over. And she's hoping to roll it out in the United States when things maybe are a little bit more politically receptive to that. Rethinking Materials is another organization she started that is entirely devoted to lifting up startups that are thinking about how to use different materials that are nature-based, like seaweed for clothing, or different kinds of dyes that are environmentally sustainable, and how to invent and then take to scale alternatives to plastic. And then the Innovative Community Action is in Canada. Reposit is what it's called. And that is a whole full life cycle designed to reduce single-use plastics and waste. But it is a collaboration with the community and manufacturers, so that you can go into a store with a reusable container and refill your shampoo, for instance, without having to buy in plastic and throw it away. There's lots of these out there, and if I know at the end, if we have time, we can talk about them. But I will leave you with another Calvin and Hobbes cartoon that he says, you know what's weird is day by day nothing seems to change, but pretty soon everything is different. And I do believe that if we each commit to making changes and to contributing to governmental changes in our own communities, even at a community level, eventually we will get there. We sent the Hubble telescope up. We went to the moon. We created computers that we hold in our hands. We can do this. We can solve the plastic crisis. And with that, I will end. Thank you so much.
Wow. Oh my, thank you so much, Dr. Carpenter. That was fascinating and a little bit stressful, but that's okay. I think I could listen to you talk about that for hours. Amazing information. Thank you so much for sharing. It rolls us directly right into Mr. Ryan Call. Let me share my screen. Please put your questions in the chat. We will do a Q&A after for the sake of time right now. And let's hear from Ryan about what we're doing in Colorado.
All right, my screen froze right as I was about to get started. So, of course, now I'm back here. All right. Before we get going here, I just want to thank Dr. Carpenter for that presentation. A lot of information, very sobering, but I think you left off on a note that I'd like to pick up on doing something about this issue. And I'd also like to thank all the attendees listening tonight. Spending an evening learning about environmental issues, it can be difficult, but I'm grateful for all of you that are joining and asking questions, and most importantly, doing something about this issue. So if you go to the next slide, well, actually, stay on this slide for a second. I'm going to try to keep this to around 20 minutes or so. For those who know me, know that I talk trash all day, every day. I love to do it. But I'll try to be succinct so we have time for Q&A here. So talk a little bit about our efforts just this last weekend, talk about EcoCycle's perspective on plastics. That could be a whole day's worth presentation. And then talk about some of the policies that EcoCycle's worked on along with champions across Colorado. So next slide, please. So I'm a big believer that if you're feeling hopeless on any issue, just do something, do anything. And part of that was hosting a litter cleanup for Plastic Free July. Lex and I hosted competing litter cleanups. Lex, I've learned, is a competitive person, and I thought I would try to beat her with the litter cleanup, but alas, maybe next year. And that is an official re-challenge. But um, yeah, Saturday we hosted litter cleanups in Fort Collins with our friends Foco Trash Mob. Shout out to Foco Trash Mob and the Larimer County League of Women Voters who showed up. And we picked up a lot of litter. What you see on the tarps here in the photos, this is just a fraction of it. And then we, which I thought was new for me, categorized and counted what we found to see if there are any trends. And this is what we found. And we learned along the way too. I think next time we'll do its own category just for straws and an own category just for food wrappers. But um, with a group effort, we disrupted a lot of mostly plastic pollution, not exclusively, but mostly plastic pollution just from nearby parks. And it doesn't take a group of people to host a litter cleanup. If you'd like to learn more about hosting a litter cleanup, I'm happy to talk about that. You can just pick up litter as part of walks, but it is a lot more fun with a big group of people. So you can see smiles on our faces on that last slide, but um, there was a lot of plastic. Thankfully, we just talked about this today. There were fewer single-use plastic bags than likely in previous years. Not that we've categorized this in previous years, but just looking around, in my lifetime, I was used to seeing single-use plastic bags, but we'll touch on that in just a little bit here. Lex, did you want to mention anything about the litter cleanup since you won that one?
Very proud to have won. Thank you, Ryan. No, it's a really wonderful community building. I also noted the lack of plastic bags, thanks to the PPRA, the Plastic Pollution Reduction Act. I will say we had a lot of clothing, which, as we learned from Dr. Carpenter, was mostly made of plastic, I'm sure. And that was very surprising to us. But yeah, it was great.
Yeah, and I'll add just a little bit of framing on plastics and just start with saying that the topic of plastics in general, especially in the recycling world, can be controversial. Um, Depending on who you talk to, they may frame things a little bit differently or disagree on certain points on how to approach this issue. But EcoCycle occupies a kind of unique space here because we are both a recycler and a zero waste advocate. So we can bring that inside recycler information to larger anti-plastic pollution efforts, which has, in my experience, has been kind of a important middle ground to bridge that gap and to be at tables that you may otherwise not have been invited to because of that unique perspective. And I do want to, maybe we can hit the next slide here. I do want to emphasize something that Dr. Carpenter already said, and that's coming from a recycler, we will not recycle our way out of the plastic pollution crisis. There's just too much of it, and I'm going to repeat it for a dramatic effect. We will not recycle our way out of the plastic pollution crisis. We need less plastic production. And a lot of the plastic that is produced is unnecessary or problematic. A lot of the stuff that we found at our litter cleanups, we could do without in life, I believe. Um, so as you already heard, there's just an abundance, and this issue is cumulative. That you've seen in the science already, and it's not going to go away if we just keep making more of it. There are, and I believe that there's. I wish I had a better I forget the term for this, but there's no silver bullet. I'm trying to find a better way to rephrase that. There's no one solution to this crisis. It's coming at it from so many different angles, and that's what I'm going to touch on here is some different approaches that EcoCycle as an organization and our thousands of EcoLeader volunteers across Colorado and beyond have taken action to get some of that systemic change. One other point on that is, working in environmental issues, people have often asked me, do individual actions really matter? Especially when it comes to recycling, they say, I recycle what I can, but I see larger wildfires or environmental issues, and I just think, is it worth it? And I say, absolutely. Because at EcoCycle, we believe that empowering individuals with the information and the skills to make that change is what makes that change. It leads to those systemic changes that then creates a feedback loop to make it easier for individuals to, for example, recycle. And I'll talk a bit about one program that is really expanding that effort. Next slide, please. Now, as I mentioned, plastics are controversial, and people don't pull me aside and say, Ryan, what's really happening with our cardboard? What's really happening with our aluminum cans? And the reason is because plastic is not one thing. It's a class of materials. And as we heard, in a lot of ways, has made our lives better. And I'm starting with that because there's so many issues with it. But you think about in the field of medicine or in food safety, um, there are a lot of benefits to this kind of miracle material, but with that comes a lot of challenges that we're working to address. So I wanted to take a minute to discuss just what makes something recyclable and why plastics have an issue with that. Before this call, Dr. Carpenter said, I'm not really talking about recycling. Is that okay? And I said, it's fine. I'm not talking about human health. So we'll stay in our lanes here a bit. But um, so the question of what makes something recyclable, starting with, can it be collected conveniently? If it's not collected, then it's not going anywhere and it's not going to be recycled. Um, Now, the next step there is, do recycling facilities have the capability to sort these materials and make it economically make sense, which is another challenge. Again, these are different types of materials. They have different properties. A recycling center or materials recovery facility, sometimes shorthanded as MRF, it's not a magic box facility. Now, we're very proud at EcoCycle to have operated the publicly owned Boulder County Recycling Center for 25 years now. And we invite the public in to take tours of this facility. I've toured a lot of recycling facilities, and I'm not shy to say that this one is the best because you can see it actually happen. And you can see that it's not, your blue bin is not a magic container where it gets taken away and it gets mysteriously turned into something else. It's a series of operations that make this possible, and plastics create issues because of the different types here. I already touched a bit about the cost of actually running that machinery and making that product efficient enough to cover costs, but to then package up all this recycled plastic and then ship it to a facility that then grinds it up and turns it into another material is a whole other issue. That's a whole other economic calculation. And some of you may have heard of China's national sword policy. I believe it was in 2018, where China stopped taking a lot of the West Coast's recyclables. A lot of that was plastics. And that disrupted global systems. But from my perspective, that really created an opportunity here in the United States to take a closer look at our consumption and waste habits and really address it, because away is not a place. You don't throw things away. These are valuable resources that can be recirculated if we set up the systems to do so. Okay, next slide here. Keeping an eye on the time. I think I touched on all this already. Plastics are not one thing. Some types of plastics are easily recyclable, some are not recyclable at all. And if you want to see lists of what is accepted, we'll be sure to include EcoCycle's recycling guidelines on what is and is not recyclable. We'll keep moving here. Next slide, please. When I was hired on, I was told or asked to say out loud that we recycle plastic bottles, tubs, jugs, and jars 3 times. Bottles, tubs, jugs, jars. Bottles, tubs, jugs, jars. Because the little recycling symbol, the chasing arrow symbol that we all know, that can be put on really anything, except for in California that just recently passed a law that's being sued over at the moment. That symbol is unregulated, and on plastics, it just signifies what type of plastic resin it is, not whether or not it's recyclable. So here's some of our graphics here. through our Center for Hard to Recycle Materials, we also recycle hard to recycle plastics, such as buckets and others. I'll skip kind of how clean is clean, but just emphasizing that for a lot of folks, our introduction to environmental issues is the phrase reduce, reuse, recycle. It was for me. But it took a long time for me to realize that that phrase is listed in the order of environmental preferability. So it's best to reduce, then reuse, then recycle. Recycling gets a lot of attention, but just wanted to emphasize that point. Next slide, please. So, as Alex mentioned, I work in the policy and campaigns department, and it has been a really fascinating arc in my career. I was hired on in spring of 2021, and in that time, can see a list of bills relating to um, waste, recycling, and circularity that have passed on the Colorado legislature. And this is just at the state level, not counting local policy that has passed. And I wanted to touch on two of that passed and then one bill that was unfortunately vetoed, but more to come on that. So next slide, please. I want to touch on producer responsibility for recycling. This is um, one really transformative law that will expand recycling access at no cost to all Coloradans. And the way this program works is that the producers of packaging they're taking responsibility for the cost to recycle these materials now. Um, at the moment, it's individuals, it is taxpayers and subscribers to recycling services who pay for recycling, but this will go back onto the big brands that make so much packaging. They will pay into a pot of money that will pay for the collection, transportation, processing, and also education and outreach to expand recycling access across Colorado. But that's just one aspect of this policy. If you'll bear with me for wonkiness for just a moment, there is a component in this policy, something called eco-modulation, and that is a tool that is used to incentivize more sustainable packaging, more recyclable packaging, and packaging that contains more recycled content. Um, and that's a series of financial incentives and disincentives for brands based on the type of packaging they put out there. So that particular program is kind of starting off at ground zero, but I'm hoping to see it crank up and really incentivize more sustainable packaging and less of the really problematic stuff. Next slide, please. This is from a report from the state to just emphasize the impact of this law that was passed. And just as a quick sidebar on um, passing laws, because it can sometimes seem disconnected from everyday residents across Colorado. But I want to emphasize that the only way that these laws pass anything that I've worked on, they pass because people like you on this call and beyond take the time to write to your state representatives, to show up to testify, um, to inform yourself and local elected leaders to make good choices on these issues. So it really is a group effort, even if policy can sometimes seem like it happens away. This can only happen through individuals like you all taking action. So that's a sidebar to just the impact that the state estimates this law will have on recycling, and it reduces emissions, it adds jobs, and saves municipalities a lot of money over time. So we're very excited about this, especially the components that will incentivize more sustainable packaging. And one other point that I just thought of I should have included is that Colorado is one state with extended producer responsibility, but there are several states across the US, and notably, the state of Maine sets aside its own pot of money specifically for advancing reuse infrastructure, a topic that I'm very passionate about just cutting waste out of the picture entirely. Hopefully non-toxic, non-plastic, um, reusable materials. And also the state of California, which I mentioned their labeling law, they're getting sued over that. They're also getting sued over EPR, unfortunately, specifically because that law includes a component to reduce specifically plastic packaging by something like 25% over the next few years. Brands are not happy about that, but it is the law that was passed and signed, and California is what the fourth, fifth largest economy in the world, so that would really have a resounding effect. So that's producer responsibility. If you hit the next slide, Lex mentioned this one. This was the first state law or bill effort that I worked on, and this is the Plastic Pollution Reduction Act, or PPRA, that was monumental and really does three things. It phases out single-use plastic bags at large retailers and requires them to charge 10 cents for a paper bag, which is then split between the retailer and local government. It phases out polystyrene, sometimes referred to as the trademark brand styrofoam foodware, which we heard is it crumbles into microplastics. Styrene is known human carcinogen. That's as technical as I'll get on any health issues, but the law phases that out. And importantly, this third one is it overturned an old Colorado law that said municipalities across Colorado cannot write their own laws when it comes to plastic packaging. So overturn that. And since then, some communities, especially ski towns, have passed laws phasing out plastic packaging. They want the materials in their community to reflect their values. So this was a really a big change. Colorado became the first non-coastal state to have such a law. Now you might be thinking, now wait a minute, I just saw a plastic bag at so-and-so or so-and-so serving me up something on polystyrene. And I want to address that quickly because the state, while it is a state law, the state does not have the authority to go out and enforce this. It is left to local governments to enforce, and it's been inconsistently applied across the state, but for the communities that wanted to implement this, they now had state directive to do so. So it has made an impact. And just anecdotally, as we mentioned, I saw maybe one or two single-use plastic bags in the Cashlaputa River, which is really significant. So if you hit the next slide, EcoCycle is estimating, based on the amount of plastic bags used, that since this law is passed, we estimate 1.8 billion fewer single-use plastic bags just being used. And that goes back to reducing plastics as a priority over recycling them. I should have reached out to my colleague, and I know some colleagues are on this call who could maybe explain that number better, but I believe that this is estimated based on numbers on prior to this law being passed, how many plastic bags are used per individual per year. So next slide, please. We have a guide, all sorts of resources on the Plastic Pollution Reduction Act if you want to learn more or maybe educate your city council members or your favorite local restaurant. It's a free resource at ecocycle.org/PPRA. And after this call, we will send out the recording, slides, and a series of links. So don't worry about writing this down quickly. Next slide, please. All right, now there's another state level bill that EcoCycle had led in the past, but this year in 2026, there was a bill that was led by two Cherry Creek High School students who brought this idea back to the state legislature. And that's a campaign called Skip the Stuff, which would require restaurants to simply ask customers if they want single-use cutlery or a handful of ketchup packets or a stack of napkins, really any single-use foodware accessory before automatically giving them to them. Some Colorado communities already start to do this, and some restaurants do this automatically. It's a smart cost-saving measure, and in other communities across the U.S., they've measured the amount, not just the amount of waste that's reduced, a lot of that single-use plastic waste that we find on our litter cleanups, but it also saves restaurants money. And if you're thinking, well, that's great, shouldn't it just be a best practice and not a state policy? We believe it should be a state policy because then that levels the playing field no matter where you're at in Colorado. that becomes the standard of simply ask if you need um, single use, whatever it may be. Now, this policy passed through the legislature with EcoCycle and several other partners' support, but it unfortunately was vetoed by Governor Polis. Um, and it's unfortunate because this law would have amended the Plastic Pollution Reduction Act, which is a law he signed, and I was at the bill signing. But the reasoning that he had completely conflicted with uh, the Plastic Pollution Reduction Act that he had signed. So um, we want to hear from you all. Is this a policy that you would like to see in Colorado, statewide, or in your local community? If it is, and I hope it is after hearing about all the issues with single-use plastics, scan that QR code. We'll send the link. We're hoping to just collect names to bring that to the legislature, to bring that to the next governor, whoever that is, and try it again and hopefully get this over the finish line. So next slide, please. Oh, I think I froze for a second. Okay, I'm back. To wrap things up so we have a little bit of time for Q&A, just want to emphasize that we can do things and it's more efficient if we do them together and stay coordinated. So be connected with EcoCycle through our different social media links, through our newsletter. You can scan that QR code. You can email myself or Lex. Lex, I didn't ask if I could put your email address in there, but you're the outreach manager, so I assumed it was fine. Again, you can take action individually, but it's a lot more fun with community. Next slide. That's all from me. I know that was a lot, but we have time for Q&A, and I'm curious what you all want to talk about. Thank you.
Thank you so much, Ryan. That was amazing. Both of these presentations are so thought-provoking and I think brought up a lot of really great questions. So let's jump right into it. Just scrolling through the chat here, I have a question from Jamie. How would you recommend we get Skip the Stuff built into local code? What would be the process for that?
Yeah, well, one, you could first reach out to EcoCycle's policy team because we work with local communities across Colorado. And this is something that local governments can pass. It is tricky to enforce, but I should mention the city and county of Denver passed this policy, but they're kind of unsure on how to enforce it. However, by simply passing a policy and creating communications that say this is the law of the land and you can save money for this and all the restaurants down your block are doing this now, that is a compelling case. So if you want to learn more about Skip the Stuff, you can email me, and we would love to help a community pass that at a local level.
Yeah, and Westminster would be awesome. We love working with you. This question is for Dr. Carpenter. Are you aware of any studies around how to remove microplastics from organisms, humans included?
I am not aware of any studies that show that you can actually do that safely. I'm not sure you can do it, period. I would say, though, that with respect to chemicals, there is pretty good evidence that if you decrease the input, that many of the chemicals eventually are sort of flushed out of the body through our normal excretion systems, our GI tract and our kidneys. With microplastics, there have been a couple of oddly studies in fish that have shown that over the span of 2 to 3 months, the quantity of microplastics seems to maybe decrease in the fish. So I think there's reason to hope that if you decrease the input, that eventually there is output, and you can decrease the load that your bodies carry just by decreasing how much you take in.
I was also wondering, as you were talking about the susceptibility to microplastic effects, like during that slide about healthy pregnancies versus like pregnancies that were early term, and the unhealthy pregnancies, all of them had microplastics found, but a lot of the healthy pregnancies didn't. Is there a way to tell if you're more susceptible to microplastics in your organs? Or is that like something people are studying?
There certainly could be conditions that might make you more susceptible to microplastics, and I don't know exactly what they would be with respect to pregnancies. Um, but there are a lot of studies that are looking at how we think the microplastics are impacting the placenta in particular, whether that's actual physically blocking blood vessels, because it's a very vascular organ. It really, I mean, blood flow is tremendously important through the placenta. Um, but I can't with respect to like how you could individually figure out if you are more susceptible. I think I don't know of anything yet that would be able to identify it. There are lots of companies that will, for a fee, take your blood or your urine and give you levels, and some of them are more not so much for microplastics but for chemicals. Some of them are more reliable than others, but I'm not sure I would do that without the guidance of a professional.
Interesting. Huh. Okay, we have a few questions about recycling and recycling rates. But the first for both of you, what are your thoughts on biodegradable nitrile gloves and products like it that claim these plastics will break down in the landfills? Can you speak a little bit about that?
What good is it if it breaks down in a landfill if it just stays whole? Maybe this person's also getting to single-use compostable bioplastics, which, from our perspective, it's still single-use. While it's not a traditional petroleum-based polymer, there are other environmental issues associated with them. It's typically derived from monoculture corn that takes out a lot of land, a lot of water, a lot of fertilizer. So again, reduce, reuse, recycle in that order.
I would also just add that many of those, unless they're truly, truly labeled compostable, most of those also have chemicals that have been introduced to them, so they're not free of the chemical leaching issues that also exist.
Yeah, that's a great point. Reduce, reuse. Okay, we only have 1 minute left, so I'm going to end on this. It is very easy to get bogged down by bad plastic news and be very negative when it comes to plastics, especially in our world. But is there anything going on, any innovative solutions that you can think of that's really inspiring you right now as we move forward?
What's inspiring me mostly is people who care, people who show up, who educate their friends and family. Even if it is a difficult conversation, these topics can be really difficult. I'm less focused on the technological side and more so on the people power.
People power.
And I would say, similarly, community. I think Healthier in Water Colorado works with our health advocates to really get the word out around communities and to empower every individual to take action and to make a difference for themselves as well. As far as innovations, the slide that I showed that has the startups, the link to the startups, there are some really, really amazing products that people are. It's going to be a long time before they can come to scale at an affordable level, but I think we have the capacity to do this, and I think there's some really smart people working on really innovative options. So.
Well, that's amazing. Thank you both for being here and for presenting your information. Thank you for all of our participants in the audience that listened and participated and asked questions. This is such a wonderful group that's engaged in sustainability, and we will see you again. Ryan and Dr. Carpenter, is it okay if I share your contact information with anyone that has follow-up questions or is interested in potential speaker opportunities in the future? Wonderful.
Absolutely.
Okay.
Yep,
We will be sending
absolutely.
out this. Perfect. Thanks. We will be sending out this recording and these slides and all of these resources that we have to you all after and probably next week. Thank you, everyone, so much for joining us. Have a great night.
Thank you.
Bye.
Bye-bye.